Good evening, I'm Andrew Chang. Tonight, Canada confronts the coronavirus pandemic. The Prime Minister's wife tests positive for COVID-19. Both are now in isolation.
Try and maybe limit some of those interactions.
The growing movement to reduce health risks.
I'm Adrienne Arsenault in Baltimore, the center of the global battle against the virus. How scientists here are tracking where it is and where it's going next. Their take on Donald Trump's plan to ban some travel.
I think our entire focus has been wrong.
The worst day on the stock market in decades. Is Ottawa doing enough to protect the economy? Rosie, an ad issuer here. And what you need to know about the virus, the test, and keeping you and your family safe. Extensive coverage. This is The National. Well, any lingering doubt is gone. The coronavirus outbreak is accelerating. Tonight, the world is reacting and responding, while here in Canada, the impact on daily life is growing. Markets tanked again. More schools are closing, major events are being canceled, all while experts warn that a dramatic spike in cases is coming. Tonight, we examine the latest on the outbreak, what's changed, and the response, along with the implications for you, your family, and how you work. Now let's start with the cases in Canada. The virus is reaching new communities and new provinces, while BC, one of the hardest hit, has advised avoiding all non-essential travel outside Canada. Manitoba and Saskatchewan each announced their first positive tests for COVID-19. Alberta is seeing 4 new cases, so 23 there now in total. There are 8 more in Quebec. They've got 17 cases. British Columbia is up 7 cases to 53 total. And in Ontario, there are 60 confirmed, 17 of them emerging over the past 24 hours. Now, we do have major news out of Ottawa tonight. We've learned the Prime Minister's wife, Sophie Gregoire Trudeau, has tested positive for COVID-19. She and Justin Trudeau are in isolation. David Cochran walks us through what this means for them and the country.
It was only Wednesday that Justin Trudeau was asked if he had been tested for COVID-19 and said no. Now the Prime Minister is in isolation for 14 days after his wife, Sophie Gregoire Trudeau, tested positive for COVID-19. The test done after she experienced mild flu-like symptoms following an appearance at a Wee Day event in England.
I'm sure I speak for all members when I convey our best wishes to the Prime Minister and his wife and any other parliamentarians who may be affected by symptoms, and wish him a speedy recovery.
2 other cabinet ministers, Mary Ng, the Minister of Small Business, and Natural Resources Minister Seamus O'Regan, are also in self-isolation. So is NDP leader Jagmeet Singh and a growing number of backbench MPs.
We need to continue to listen to our medical experts. They are telling us that the situation will get worse before it gets better.
Before his wife tested positive, the Prime Minister canceled his meeting with the premiers, even though some of them were already in Ottawa.
But that's just an indication of how quickly events are developing. And so we are all rightly concerned about the global crisis that we are facing.
This won't be the end of it. A committee of MPs had 2 meetings to discuss options to keep MPs and staff safe. Sources say that could include an extended shutdown of the House of Commons.
So, Andrew, we have a statement from the Prime Minister's office tonight with a comment from Sophie Gregoire Trudeau. She thanks people who have reached out to her, saying, "Although I'm experiencing uncomfortable symptoms of the virus, I will be back on my feet soon. Being in quarantine at home is nothing compared to other Canadian families who might be going through this, and for those facing more serious health concerns." So, Andrew, a difficult situation, but a positive attitude from Sophie Gregoire Trudeau so far tonight.
Right, fair enough. But I mean, the PM is in isolation for 2 weeks. How does this affect his capacity to lead?
Yeah, this is an extraordinary situation, having the Prime Minister in isolation like this. But what the Prime Minister's office tells us is that the Prime Minister will continue to fully assume his duties. He will address Canadians tomorrow, presumably through video. And we have to reinforce he is feeling fine. The Prime Minister has no symptoms. He just has to isolate. In fact, he's going to go ahead with a telephone or a video meeting with premiers and national Indigenous leaders on Friday. And even today, before the positive test, Andrew, he was speaking with the Prime Minister of Italy, the Prime Minister of the United Kingdom, U.S. President Donald Trump, talking to key G7 allies and how they're going to coordinate their G7 response, their COVID-19 response. So the plan is business as usual, even though nothing is usual. And a key point here is that even though he's in isolation, and even though Sophie Gregoire Trudeau has tested positive, the Prime Minister will not be tested, and they say that is on the advice of doctors. And Andrew, if you look at their entire response to COVID-19, it has been led by science and medical advice, and they're not going to deviate from that, even when it involves the Prime Minister's personal health.
Okay, David Cochrane in Ottawa tonight.
Thank you.
Now today, the Ontario government took a drastic step to slow the spread of COVID-19. After March break next week, it's canceling classes at all public schools for 2 additional weeks. That affects about 2 million students. And as Thomas Daigle shows us, for parents, it was a very sudden surprise.
Right on.
Like many Ontario parents, Christine Gauthier is getting ready for 3 whole weeks of this.
Penelope only because
you released.
Her daughter Fiona at home for an unexpectedly extended break.
I thought maybe the schools would close, but it was just like an extra 2 weeks. Wow, what are we going to do?
She's left scrambling. Consider just this morning, Premier Doug Ford encouraged worry-free March break travel.
I just want the families and their children to have a good time. Go away, have a good time, enjoy yourself.
Within hours, though, Ontario's top public health expert warned traveling abroad would mean self-isolating upon return.
We've had just recently a lot of cases from various parts of the USA, and so that concerns us in that regard.
The worry? Families could bring back the coronavirus.
Good afternoon, everyone.
So the education minister announced all publicly funded schools would close for an extra 2 weeks to try to slow the spread.
We recognize the difficulty this imposes on so many members of society.
It's already been a tumultuous year for Ontario schools, with parents scrambling for childcare more than once. Now this.
Between the unknown of the strike action, which every week was sort of new news, and then now this, it's sort of like, okay, well, trying to keep it together.
We're fortunate enough to have some flexible work hours so we can stay in and do some fun things.
Playing games.
Who's going to do more homework?
Not me. Not me.
As for Gauthier, she's just hoping Fiona will make up for lost time.
I feel like it's a lot of school to be missing, you know? I'm trying to help my daughter with her math and her French.
And there was nothing like.
Even during the extended break, the province is looking for a way to keep kids focused on learning. Somehow. Thomas Daigle, CBC News, Toronto.
Now, today also marked a substantial shift in the way several other provinces are handling the outbreak.
It's a major change, I understand that, but the situation is very critical.
Quebec's government has gone into what its premier calls emergency mode. As of today, all travelers returning from any foreign country are being asked to self-isolate for 14 days. And for public servants, that quarantine isn't merely a suggestion, it's a requirement. The province is also canceling all indoor events with more than 250 people.
We are advising British Columbians against all non-essential travel outside of Canada, and that includes the United States.
Officials in BC urging people to reconsider their travel plans, and those who do leave the country also being told to self-quarantine for 2 weeks upon their return. The province has also taken an unprecedented step, calling on retired doctors to re-register, asking them to come back to work in light of this pandemic. Officials say it's a proactive step in case BC's healthcare system gets overwhelmed. And the first known cases of children being infected in this country are being reported. Calgary shut down this daycare after a 2-year-old tested positive for this coronavirus following a family vacation to the U.S. Every child, their families, and the 24 staff members from the facility have been told to self-quarantine. And in Ontario, officials say a baby boy was among the 17 new cases in the province. he was said to be in close contact with another patient. So all of this has left Canadians with plenty of questions. To answer some of them, we're joined by infectious disease specialist Dr. Abdu Sharkawi. And Dr. Sharkawi, a lot has changed over the last 24 hours. Tell me, what should Canadians be doing to prepare over the next 24 hours?
Well, I think first of all, Canadians can expect that things are going to become a lot more inconvenient over the next 24 hours. We can anticipate that there are going to be long lineups and crowds in places that we ordinarily frequent for our everyday activities and grocery stores, banking facilities, and the like. I think we all need to take a step back and really pare down things to minimalism and decide for ourselves what's absolutely essential. When it comes to groceries, my wife was at Loblaws and she came back 2 hours later like she had gone through war. I think you have to prepare with common sense alternatives, maybe looking at online alternatives for getting your groceries, looking at getting your prescriptions renewed, urgent medical business, anything that you think really can't wait until next week perhaps or beyond, you probably want to take care of sooner rather than later, because we probably anticipate things are going to get much worse before they get better.
And in terms of just how quickly things have been shifting, the ground underneath our feet, I mean, tell me a little bit more about what we ought to expect.
Well, in terms of the number of cases, I think we can expect that that's going to accelerate. There's going to be an emergence of new cases that are probably going to be spawned both from within the community and from travel links that we hadn't anticipated, including in particular the United States.
Dr. Sharkawi, thanks so much.
Thank you for having me.
Now, limiting exposure to this coronavirus is what's behind the cancellation of a number of major public events. Among them, this Sunday's Juno Awards in Saskatoon. They're off. The Canadian Screen Awards, planned for March 29th, canceled. In New York, Broadway shows are closed for at least the next month, and spectators were barred from today's lighting of the Olympic torch in Athens. Also, many professional sports leagues are either restricting fans or suspending games altogether. That's the situation with Major League Baseball, the NBA, and the big one for many Canadians, the NHL. Here's Cameron McIntosh with how that could all pan out.
In Josh Mezojednik's kitchen, it's a simple recipe. When the Winnipeg Jets play, business is good.
We get super busy. We'll fill up, right away around 5, 6 o'clock.
So, to suspend the season.
It's quite unfortunate that it's come to this, but it's also understandable. Whatever we could do to prevent the risk of exposure.
When the NHL comes back and how it will all work is still up in the air, says the owner of the Jets.
It's just too early to tell. Whether we're in a postponement or a cancellation, we really have to, yield to the science.
In a statement, the NHL said it's following the advice of health experts, encouraging players and staff to take all reasonable precautions, including self-quarantine if necessary.
It really is going to start to have knock-on effects, and that could easily spill over into the broader economy too.
Sports economist Moshe Landers says the move by the NHL and other leagues will be disruptive to bottom lines. The NBA and NHL both make a lot of money in the lead up to and during the playoffs.
It really is not just a mix of whether you're a large market or a small market, it's whether you're going to be in the playoffs and how long that run is going to be.
In Toronto, Raptors and Leafs fans reluctantly support it.
I guess it's definitely devastating for sports fans like us.
A lot of people are dying, so I think it's a safe and important move.
It's not just sports. Those venues host other events. For concession and other temporary workers, it means lost work. Josh Goslin sets up stages.
But they said, well, we're going to be out of work for like a couple months.
The 1919 Stanley Cup final was canceled over the Spanish flu. Chipman is optimistic there will be a champion in 2020.
I could see it going into July.
And from the NHL and other leagues that have announced cancellations and delays, there's a common message to fans and especially ticket holders. Bear with us. Cameron McIntosh, CBC News, Winnipeg.
Now again, these cancellations are based on the speed and spread of this outbreak. So let's take a wider look at the situation. So far, the number of confirmed cases globally is more than 128,000. There are more than 1,500 cases in North America. That number keeps ticking up, with at least 150 in Canada. Now, these red clusters certainly tell one story, but there is another side to it. Since this outbreak began, more than 68,000 people have recovered. That's good news, but it may take time for that to translate to investors. We did see more record-setting drops. The Dow down by 10% and the TSX 12%. Aaron Saltzman has more on another stop-and-start day for the markets.
The wave of selling started overnight in Asia and Europe. By the time North American markets opened, it was a full-on tsunami. New York and Toronto falling so far, so fast, it triggered automatic trading halts. The second time that's happened this week. This time, the catalyst was the U.S. president.
We will be suspending all travel from Europe to the United States for the next 30 days.
Check out the straight line down the minute Donald Trump started talking about travel restrictions. Follow that up today with yet another cascade of concerning coronavirus news, and the result.
Well, you saw the worst day in financial markets since 1987 in the United States, and in Europe, the worst day ever.
The worst day ever in Canada, too. Meanwhile, the warnings keep coming from fiscal policymakers.
COVID-19 has been a major shock to the growth prospects of the global economy and the euro area economy.
What then should individual investors be doing now?
I'm focused on helping them manage their fear and ensuring that they make decisions that are based out of logic as opposed to based out of fear, because decisions based on fear are generally the ones that you regret.
It's too late to make wholesale changes now, she says. If you can't handle the volatility, make the move to more conservative holdings before the next crisis. Retiree Jim Allen's portfolio is already low risk, but with most of his income coming from his investments, these are still uneasy times.
I think this will come back. We don't know when.
So he'll ride it out, he says. At this point, there may be no other choice. Aaron Saltzman, CBC News, Toronto.
So between basketball, hockey, large gatherings, schools across Ontario, it can feel as if society itself is getting cancelled. But with the risk of COVID-19 slamming into Canadian emergency rooms and ICUs, experts say each time someone avoids the virus, they buy time for everyone else. Christine Burak gives us a primer on the power of social distancing.
Putting at least a meter between yourself and someone who might be sick isn't always easy.
This is roughly the distance that's being recommended. So if you're near someone, is this comfortable?
Considering the situation, yes.
For others, it seems unrealistic.
Honestly, like in crowded areas, probably not.
Scientists say social distancing can make a difference if done early enough.
This virus moves really quickly, and that's what we really need to try and work on in terms of mitigation right now.
Singapore and South Korea both have large numbers of infections, but they're keeping people apart. No big gatherings. They even have drive-through virus testing. Unlike Italy, neither country has locked down its residents, but the pace of outbreaks has slowed down, and researchers say Canada could do the same.
It's not outside the realm of possibility.
The research isn't peer-reviewed yet, but models at the University of Toronto suggest even if they find and isolate mild cases, half of the people in Ontario could become infected. But with social distancing measures, people working from home, school closures, canceling of sports events, concerts, and conferences, models show the number of new infections drops significantly, allowing hospitals to keep up with the number of sick patients.
Unfortunately, there's no silver bullet here. There's not going to be one intervention that we can do that's going to make this go away. But I think that social distancing is a really key component.
What do we do on a daily basis where we're in close contact with people around us? And what can we do to try and maybe limit some of those interactions?
Keeping people apart will be socially disruptive and economically damaging, but scientists insist it will also save lives. Christine Burak, CBC News, Toronto.
So keep your distance, but what if you get sick? We'll take a closer look at the COVID-19 test itself and how it works. Plus, fallout from those contradictory messages from the White House last night.
I don't think there was confusion.
And Adrian was at Johns Hopkins University in Baltimore today, where experts are tracking the virus.
Infectious disease specialists here are not just looking at where the virus has been, they know where it's likely going. What they've discovered about how the virus behaves and how quickly it could spread, that's next on The National.
We are back with our top story, the unrelenting growth of the COVID-19 pandemic. That's why Adrian is in Baltimore tonight.
That's right, Andrew. This is the home of Johns Hopkins University, a specialized medical research center tracking the spread of the coronavirus. In one sense, this galloping threat comes as no surprise to the experts here. Back in October, they ran a simulation that anticipated just this kind of outbreak and how it would multiply, with cases doubling every week. Just a little bit later, I'll show you what else they found. But first, let's check out the impact here in the United States of Donald Trump's surprise announcement last night, a 30-day ban on travel from Europe starting tomorrow at midnight. Paul Hunter has the political fallout from a speech that wasn't quite right.
In efforts to calm his jittery fellow Americans, Donald Trump last night misspoke.
We will be suspending all travel from Europe to the United States for the next 30 days.
In fact, it's not all travel. Americans in Europe and U.S. legal residents will be allowed to come home. Today, the vice president clarified.
I don't think there was confusion. They'll be screened, and then we're going to ask every American and legal resident returning to the United States to self-quarantine for 14 days.
Meanwhile, airlines are scrambling to figure out what it all means for them, how they'll deal with the sudden change in travel from Europe. And though the UK is exempt from Trump's ban, the rest of the continent is more than a little put off by it, stunned that it hadn't even been consulted before Trump took action.
We get along very well with the European leaders, but we had to make a decision, and I didn't want to take time.
A larger question, is there merit to the ban anyway?
Banning all travel from Europe or any other part of the world may slow it, but as we've seen, it will not stop it.
Still, one of the leading scientists helping direct U.S. policy on the virus today underlined the ban was the right call. It will help.
New cases throughout the world, the majority of them are from Europe to other countries. If you look in the United States, at states that have new cases, the majority of them are coming from that region. It was based on that the travel restriction was suggested and accepted.
It's Trump's biggest crisis since taking office. His response watched carefully as the country wonders where any of this goes from here. Paul Hunter, CBC News, Washington.
So now let's see how Trump's announcement has stirred things up in Europe, where 22,000 cases of COVID-19 have now been confirmed, according to the World Health Organization. And now there is a looming deadline for some to get out. Briar Stewart shows us that.
Across Europe this morning, a rush to airport terminals. In those long lines, plenty of anxiety and confusion.
There's definitely been a lot of uncertainty, which has caused a lot of panic.
We're supposed to leave on Sunday, and now we're trying to get home earlier, obviously. It's actually our honeymoon.
There are reports some were so desperate to get a new ticket out, they paid thousands of dollars extra. Some passengers weren't aware U.S. citizens are exempt from the ban. Others didn't want to take any chances, given how quickly countries are tightening their coronavirus controls.
À toutes les personnes âgées de plus de 70 ans.
Today, Emmanuel Macron urged elderly people and those with health issues to stay at home for as long as possible. France, along with Ireland, joined a growing list of European countries closing schools and universities, all in an attempt to slow the spread of COVID-19 and avoid the fate of Italy, where more than 1,000 have died. This Italian actor pleaded to have someone come and pick up the body of his sister, which remained in the family home with him for 36 hours before it was removed. Outside, along the eerily deserted streets here, a sense of dread that this is far from over.
We are worried for the future because what is happening here probably could happen also in other parts of Europe.
And it's starting to, which is why governments are rolling out plans and preparing the public.
More families, many more families, are going to lose loved ones before their time.
UK officials say the spread of the virus here is likely 1 month behind Italy. Unlike other countries, the UK government hasn't shut down schools or restricted mass gatherings, saying it's too early for such drastic measures because the peak here might not be until the end of May. Briar Stewart, CBC News, London.
The U.S. president has said COVID-19 took the world by surprise, but it didn't really. Here in Baltimore, armed with reams of data and cold hard math, researchers modeled exactly how an outbreak like this, a coronavirus outbreak, would unfold months ago. The virus is behaving as predicted. The surprise is the reaction from some governments, including the United States.
This board has been urgently convened by the World Economic Forum.
It was a new coronavirus and spreading fast, killing 7% of those infected.
We could be looking at double the number of cases in 1 week.
That was the drastic fictional scenario drilled at Johns Hopkins University in Baltimore last October, with health and industry officials from around the world imagining the what-ifs.
I worry we're suffering from a delusional disorder.
If they contribute more, that they will have a better chance.
You need the money. So where's the money?
Within 8 weeks, it had all happened. The real COVID-19 is less lethal, but the disruptions are exactly as anticipated. The stock plunges, stranded cruise ships, canceled events, all unfolding on schedule as they did in the simulation. Back in October, made-up newscasts told the stories.
Public health agencies have issued travel advisories.
Dr. Eric Toner ran the October simulation, said it was clear then to all the nations participating that travel bans didn't work, caused enormous economic harm. In the simulation, a few countries still went ahead with them, but not many. What did you think when you heard the president's travel ban last night?
Well, I think travel bans are ill-advised. They are counterproductive. They certainly would not do anything useful currently. There's plenty of COVID-19 in the United States.
So you were mad last night?
I was disappointed. I think we've been focused on the idea that we could contain the disease elsewhere, keep it out of this country. I think that was obviously not true from the very beginning. And we should have been spending the last 2 months getting prepared.
The future? Johns Hopkins runs an hourly interactive map of the infections. Watch North America, France, and Germany to change fast, Dr. Toner says. An infection rate doubling roughly every week, just as predicted. And we've been doing some more talking with those who model pandemics and their responses. And so next week, Andrew, we will go through what they anticipate will happen next and where, and crucially, what needs to happen right now to make this a little less painful for everyone and certainly to save some lives.
Yeah, critical information, absolutely, Adrian. And up next, we will have more need-to-know information for you, including a closer look at how the COVID-19 test itself works. And Rosie is back with that issue.
Andrew, there sure is a lot to talk about. A global health pandemic, growing economic concerns, and of course, the political response. Chantal, Andrew, and Paul Wells will join me after the break.
This is a public health crisis that we have not seen in recent times.
Our government will do whatever it takes to keep Canadians healthy and safe.
We've been in constant communication with all the provinces and territories.
We do work very closely and collaboratively with our counterparts in the United States.
We're following the science and the evidence.
That's been some of the messaging from the federal government today on COVID-19, but the situation is obviously a fast-moving one. So how does the government manage this crisis? How is it managing it? It's Thursday. I'm here with At Issue. Chantal Hébert is in Montreal, Andrew Coyne is in Toronto, and Paul Wells is with us tonight in Ottawa. Good to see everybody. Just from the perspective of how the government is managing yet another crisis, this one a pandemic that is personally affecting them, given that they are self-isolating today. I guess in terms of tone and leadership and the kinds of things that a government needs to do in a moment like this. Chantal, do you want to start?
Well, I guess the first thing is that there is no roadmap for this, but there is no sense in thinking that it's going to be a small thing. There is previous experience now in Italy and China, and what's happening in France and Spain. It all sends the same signals. I was listening to Question Period today, and the answers from the government were vague, but the subtext seemed to be that the government expects and is waiting for the other shoe to drop.
Andrew?
It's been an uncertain response, but forgivably so, because this is an extremely difficult thing to get one's arms around. When you're dealing with exponential growth, potentially exponential growth in caseloads such as we've seen, I think they've been a little bit behind the curve, shall we say, but it's dawning on them as it's dawning on the rest of the public how serious this is and how serious it potentially could be.
Paul, what do you make of their approach so far, their tone so far?
I think the Trudeau government has benefited from having had good players in place already, almost by accident. Yeah. Theresa Tam, the head of the Public Health Agency, was appointed by Jane Philpott, mostly to look after the opioid crisis, which continues. Patty Hajdu, the health minister, turns out to be one of the most poised and confident and reassuring presences in this government. And it should be said that the federal government is not in charge of any kind of response to a crisis on this scale. Provincial governments, city halls, public health agencies right across the country, and ordinary Canadians who traditionally have been very good at following smart advice in good faith. And I think all of that has led to the early stages of this crisis not being as bad as it could be. I make no predictions for next week.
Yeah, I mean, the thing that has struck me is the way, one person said to me, the sort of deference to science that you're seeing as opposed to what is happening in the United States, for instance.
Yes, but deference to science is well indicated in this case.
Yes.
Justin Trudeau is about as knowledgeable of public health issues in the sense that is needed as we all are tonight. So if we didn't have science and medical experts to rely on, but also the experience of the countries who have been going through this on a larger scale for a bit longer than we have. What would you like to rely on? I don't think we should ever measure the quality of our government's response by the standards of what is happening in the U.S.
I knew you were going to say that to me, yes.
Well, because
you're right.
if we do that, we're not setting the bar low. We are setting the bar below any acceptable level.
But it's a critical asset, though, that you still have levels of trust in this country that seem to be rapidly disappearing in the United States. You know, if the experts are right in some of their grimmer projections on this, we're going to need to mobilize society on a grand scale to fight this, both in the sense of being willing to accept quite draconian restrictions imposed by government, and in the sense that Paul referred to of being willing to make alterations in our own lifestyle. To mobilize people, a society like that, they have to trust in their leaders, they have to trust in experts, they have to trust to some extent in the media. On all these scores, we do quite a bit better than the United States. I realize that's setting a low bar.
That's a good point. Let me turn a little bit to the economic uncertainty that the coronavirus creates by the shutdown of the tourism industry and all sorts of things, the drop in the price of oil, and a government that is still planning to table a budget on March 30th. Here's a little bit of Bill Morneau and what he said tonight.
This economic volatility is real. So I've actually gone ahead and asked the private sector economists who help us to form the basis of our economic forecasts, come back with a refresh of their expectations.
So the government so far has put forward $1 billion package, but it was very much health-oriented, research-oriented. They say there is more there and more coming potentially in terms of the economy. Paul, that I think we can credibly talk about in terms of what the government should be doing or what more the government should be doing there.
Well, it's tricky. I mean, 10, 15 years ago, in the middle of some comparable crisis, you could expect the central bank to cut interest rates markedly, and you could expect a federal government to spend large numbers of billions of dollars through tax cuts or checks to people or spending programs. Unfortunately, interest rates have lately been close to rock bottom, and this government was already spending very close to the ability of the economy to handle it without the debt increasing in relation to the GDP. And so that doesn't leave it a lot of room to maneuver.
Chantal, go ahead.
But this is, it may be just me, but I see the upcoming federal budget as a Band-Aid on a huge wound, and that's because until this crisis is resolved, I don't think any federal budget or provincial budget is going to do more than try to fill the gaps and get people over the other side of the crisis. This is also far beyond the control of any national government. When markets are crashing the way they're crashing, the oil prices going the way they're going, no single national government will suddenly wake up at the end of March and say, here's the recipe to get out of this trouble. We've seen a number of budgets over the past few weeks that have been outdated with 2 days after they were presented. The Alberta budget, the Quebec budget this week in surplus. Now the government in Quebec is saying we may be running into a deficit. So yeah, the budget is going to allocate money, but I think it's going to be crisis management money.
Okay, Andrew, you go ahead.
I'm skeptical of the value of fiscal stimulus at the best of times. I'm particularly skeptical of its usage in fighting a pandemic. We are going to go into deficit, deeper into deficit, just because of the nature of the situation we're in. But that's just, you know, there's going to be costs to be associated with probable recession and in terms of fighting the pandemic. What I think is really essential is that the government do everything to signal that the economy comes first, that it is their first priority beyond the pandemic, that they are going to do everything to reassure and provide confidence to investors and to business.
We really are going to have to wait for the budget if he gets to implement it. I mean, what else is going to be canceled?
Okay. Thanks, everybody. Appreciate it. Before we go, be sure to subscribe to At Issue, the podcast edition, for extra content. This week, we are going to pick up right where we left off. Look for it on any major podcast app, our website, cbcnews.ca/The National. For now, though, back to Andrew in Toronto.
And coming up, the cruise conundrum. Some Canadians are still hopping on board. Joanna Remiliotis caught up with them in Puerto Rico. And Times Square in New York. This is how most of us think of it, but wait till you see what it looks like now. Welcome back. A return to our top story tonight. The wife of Prime Minister Justin Trudeau, Sophie Gregoire Trudeau, has tested positive for COVID-19. She began to feel unwell after returning from a recent speaking engagement in the UK. Now, a statement from the Prime Minister's office said that she tested positive today and that she will remain in isolation. Beyond that, she's said to be feeling well and is getting medical attention. As for the Prime Minister himself, he's not currently showing any symptoms, but is in isolation as well. Viking Cruises, Disney Cruise Line, and Princess Cruises, which had coronavirus outbreaks on 2 of its ships, they've announced they're halting operations for weeks, but at least 90% of the industry is still booking. Joanna Remiliotis is in Puerto Rico, a hub of cruise traffic where some travelers seem convinced it is smooth sailing ahead.
Arriving in San Juan is the first step. Almost everyone on this flight from Toronto is getting on a cruise next, coronavirus or not.
As far as getting sick, no, I'm not concerned.
I've booked this trip for a year now, and I feel that I'm just going to take that chance.
San Juan is usually the busiest cruise port in the Caribbean, but some lines, including this one, have canceled all cruises. Others are still set to sail, at least for now. This while San Juan started disinfecting popular tourist spots to contain the potential spread of infection. And today, Puerto Rico's Governor Wanda Vázquez declared a state of emergency, canceling all mass gatherings.
Hoy les anuncio al pueblo de Puerto Rico que estaré declarando un estado de emergencia.
The island has a handful of presumed coronavirus cases, including tourists who are on a cruise, and has ordered ships with suspected cases not to stop at its port. Canada has advised people not to go on cruises at all, but Canadians who docked in San Juan for the evening a couple of days ago say they're not worried.
The precautions that they've been taking on the boat have really put our minds at ease, I would say. Mandatory hand washing before you go into the buffet. They serve you at the buffet instead of self-serve.
They took our temperatures, to make sure that nobody was sick.
Maybe so, but back at the airport, some are playing it safe.
We canceled the cruise, but we're still going to spend the time down here.
And this group is taking a vote to decide. Their boat is supposed to pick them up on Saturday.
We know the ship's out in the ocean right now, so we'll wait to see when the ship comes back. If anybody comes off the ship that's sick or, I don't know. If everything looks good, then we'll get on the ship.
Any certainty about what comes next? It seems that ship has sailed. Joanna Remiliotis, CBC News, San Juan, Puerto Rico.
So if you start feeling sick, What happens then?
This is what it looks like. It's a very small and quite flexible swab.
We're going to take a closer look at the COVID-19
Gets
test.
sealed up, and then
That's
the
up
tube
next.
gets sent off to the lab for the test.
I'm Jamie Poisson, and tomorrow on CBC's daily news podcast Front Burner, as the response to COVID-19 ratchets up around the world, from major sports cancellations to border closures, is Canada doing enough? Subscribe wherever you get your podcasts.
Now, one question that keeps coming up around this coronavirus outbreak is what exactly should you do if you start feeling sick? And how do you get tested? What's involved? Well, we asked Dr. Alison McGeer, who helped lead the fight against SARS, to take us through it step by step.
I'm Dr. Alison McGeer, and I'm a microbiologist and infectious disease epidemiologist at Sinai Health System in Toronto. I'm here to talk to you about what to expect if you need to be tested for COVID-19. If you think you need to be tested, what do? Well, the first thing you want to do is check with your family doctor to sort out whether you do need to be tested or not. And you want to start that process on the telephone, because if you do need to be tested for COVID-19, it's important for people to know that you might have it and to be taking the proper precautions. If you and your doctor decide between you that you do need to be tested, it may be that your doctor will have all the equipment to do it in the office. It's more likely that your doctor will send you to the emergency department to be tested there. There's two kinds of tests that are done. They both use the same swab, and this is what it looks like. It's a very small and quite flexible swab, and it's got a little brush on the end. And the nurse will put it into your nose, curl it up to the back of your nose, and then rotate it so that that brush brushes the cells in the back of your nose. It goes into the tube, gets sealed up, and then the tube gets sent off to the lab for the test. Does it hurt to get one of these swabs done? It doesn't hurt as much as it's uncomfortable. It's just kind of an odd sensation when somebody is putting a brush, even a very small one, at the back of your nose, but it's not usually painful, and it's not the least bit dangerous. The reason that it's a swab of your nose is because this virus lives in the lining of the back of your nose and down the back of your throat. So what happens if you test positive for COVID-19? It's important to remember that most people who get COVID-19 have mild illness. In general, the cases that we've seen in Canada have been people who've not been sick enough to need to be in the hospital. So you will get sent home with instructions on how to do self-isolation at home. And you'll be in touch with your public health department, who will help you if you have questions, and who will arrange for testing so that you know when you no longer have the virus and you can come out of isolation and go back to your usual life.
Now, with lots of people rethinking their travel plans, those who do venture out may very well find an eerie scene. Tourist hotspots virtually silent. It's our moment. Next. With the call for more social distancing, countries in lockdown, near empty city centers, and pro sports suspending games, there is an unusual quiet in many places that are usually incredibly busy. It's striking to hear, striking to see. This global moment of silence is our moment tonight. Strange to see such iconic places looking the way they do. And in a way, the part of that that you don't really see is the human side to it, not just in terms of the people who don't get to see those sites, but all of the people who rely on the people who go to see those sites, all of those people in the retail industry, service industry, accommodations, food. There'll be a whole lot of people who hope this doesn't stay too bad for too long. That's The National for this March 12th. Have a great day.